So the doctor has said, you have sleep apnea. Now that you've heard the diagnosis, you've been given a prescription and told to use a strange-looking contraption called a Cpap machine. Your first thought may be, I have to wear this just because I snore? You may not realize it, but snoring loudly or gasping during the night are symptoms of a very serious health problem known as obstructive sleep apnea, or simply sleep apnea. You may be saying, why is sleep apnea so bad? Research has shown that sleep apnea can worsen many health conditions such as diabetes, hypertension, and heart disease, while also increasing the risk of stroke. Ongoing sleep apnea reduces the ability to focus and concentrate and causes excessive daytime fatigue. Untreated sleep apnea may lead to sleepiness while driving, which greatly increases the potential for motor vehicle accidents. Here's what happens during your periods of sleep apnea. The word apnea means a lack of breathing or no breaths. Simply put, while asleep, a person with sleep apnea stops breathing. While awake, muscles and tissues located around our airway assist in keeping it open, so breathing isn't usually a problem. The muscles relax somewhat when we sleep, and that usually doesn't cause much of a problem since the airway continues to remain open. However, when a person with sleep apnea begins to doze, the muscles and tissues around the airway relax too much. So much, in fact, that a snoring sound may be heard due to air trying to flow through floppy tissue. The amount of tissue each person has around their airway varies. A person may have extra tissue around the airway area that relaxes to the point of temporarily blocking airflow. When the airway becomes blocked, a person's oxygen levels drop and the brain senses something isn't right. The brain signals for stress hormones to be released, causing the person to awaken just enough so that breathing resumes. That is when a person can be heard taking a big gasp or making a loud snoring sound. The crisis is averted until they begin to relax again, which restarts the cycle, and this continues over and over all night long. Okay, but I don't remember anything like that happening when I sleep. I sleep all night. You would be right except for the part, I sleep all night. A restful night's sleep consists of more than closing our eyes and drifting off to sleep. Restful sleep generally consists of 5 phases a person cycles through during the night. The 5th phase, known as REM sleep, is the one most needed for the brain and body to have truly restorative or restful sleep. It's during REM sleep that the brain sort of reboots itself. During REM, the brain reorganizes, stores memories, and makes repairs. REM sleep can only take place after the person has cycled through the other sleep stages. When a person's airway becomes obstructed, as in sleep apnea, the progression to REM sleep stops because the brain has to awaken the person enough to take a breath. Every time the person has to be reminded to breathe, the sleep cycle restarts from the beginning. Those repeated episodes interfere with sleep progression and prevent a person from ever reaching REM sleep. In short, just because you fall asleep does not mean you reach the REM or restorative sleep. And though you waken enough to resume breathing and perhaps shift in the bed, you have not fully aroused from sleep. That's why most sleep apnea patients don't remember their periods of apnea, even though they may be severe. You may be saying, well, what do you mean my brain wakes me up? Your brain is able to detect when oxygen levels in your body are dropping. As a result, stress hormones in the body are released, causing you to slightly awaken. You then either gasp or loudly snore as your breathing resumes, and all is well until after a few minutes, the same cycle starts over again. The brain must intervene to get you breathing. It sounds tiring, doesn't it? It's great that our brains look out for us and try to keep us breathing. However, the process of stress hormones being released all through the night is not without a price. At a time when your body should be resting, it is being put on high alert by activation of our fight or flight response. What is fight or flight response, you ask? Anytime our body perceives a physical threat, the brain signals for the release of stress hormones that give us a boost to do whatever needs to be done to protect ourselves. Do you remember that time you were driving while sleepy? You briefly dozed off, only to feel the tires running over the rumble strips at the edge of the road? You probably also remember your rapid heartbeat after being jolted awake. A few moments earlier, you were fighting to just stay awake, but suddenly, it is as if you are on high alert. A similar event takes place when the brain senses a threat during an apneic episode. The body is flooded with stress hormones, causing blood pressure to elevate, heart rate to increase, and a heightened level of response. Depending upon the severity of the sleep apnea, this may occur over and over all night long. Stress hormones may help us survive in dangerous situations. However, the organs of the body suffer when they are exposed to them night after night. Excessive prolonged exposure to these hormones increases the potential for uncontrolled hypertension, heart disease, diabetes, arrhythmias, and even stroke. This is what makes Cpap therapy so important, even life-saving. If a person with sleep apnea uses Cpap therapy regularly, the risks of hypertension, heart disease, diabetes, arrhythmias, and stroke are reduced to a normal level. So how does Cpap therapy work? Cpap therapy uses gentle air pressure to keep your airway open. This allows you to take in good deep breaths. Since the airway stays open, the brain and body are able to progress uninterrupted through all sleep stages until reaching REM, or restorative sleep. At this point, you may be thinking, okay, so I need to do something about my sleep apnea. But how am I ever going to wear this mask and use this Cpap machine? Many Cpap users have asked that very question. The good news is that with time they also have become successful in using their Cpap machine. Cpap therapy may initially feel strange and even uncomfortable, but with persistence you can eventually adjust to wearing it. In fact, you'll likely reach a point that you don't sleep as well unless you are using Cpap therapy. Some sleep apnea patients have great anxiety when starting Cpap therapy because the mask or positive airway pressure from the machine makes them feel claustrophobic. Whether you feel claustrophobic or just don't like feeling the mask and the pressure, there is a process that may help you to adjust to using your Cpap machine. This process is called desensitization therapy. All that means is you are going to take slow, simple steps until you've adjusted to wearing your Cpap mask and can tolerate Cpap therapy. It is important to know that if while performing these therapy steps you experience extreme anxiety or distress, you should consult your doctor for assistance. You have total control of how quickly or how slowly you progress through the steps. Here are the desensitization therapy steps for getting used to your Cpap machine. Step 1. Once daily for a week, wear just your Cpap mask while performing quiet activities such as reading or watching television. Leave it disconnected from the Cpap machine. You just want to adjust to the feeling of the mask. This is a great time to learn how to adjust the straps on the headgear to make the mask fit more comfortably. Step 2. This week is very similar to week 1. The difference this week is you'll do your quiet activities like reading or watching TV with your mask on, connected to the Cpap machine with the machine turned on. You may continue to adjust the mask for good fit. This will help you to slowly adjust to the mask and also feel the feel of the positive pressure airflow from the machine. Step 3. This week, you'll be wearing the mask with the machine turned on while you lie down to take an hour rest or nap. Since you are lying down, it may be helpful to continue to troubleshoot how the mask fits, the best place to position the tubing, and where to place the Cpap machine for ease of use. Step 4. It is time to begin using your machine at least 4 hours of nighttime sleep. By this point, you should have become more comfortable using the mask and Cpap machine. By now, it doesn't seem as cumbersome to you as you begin your nightly Cpap therapy. Keep in mind that adjusting to using Cpap therapy takes time. If you cannot tolerate wearing the mask 4 hours, wear it as long as you can and then make it your goal to increase the amount of time each night. Just because one night is not successful does not mean you should abandon Cpap therapy altogether. Even a few hours of sleep with Cpap therapy is better than no hours at all. Be patient, be persistent, and above all, do not give up. We wish you much success as you take the steps to begin your journey to a healthier and happier way of life.